In this video, we will discuss third and fourth heart sounds, their features, similarities between them, and the conditions in which third and fourth sound appear. The third sound is heard just after the second heart sound, and fourth sound is heard just before the first heart sound. Both these sounds are heard in diastole, but the third heart sound is heard in the early diastole, and fourth heart sound is heard in the late diastole. So let's discuss the third heart sound now. Third heart sound is low pitched sound that is heard after the second heart sound. Why does third heart sound occur? It's due to the rapid ventricular filling during the mid diastole. It may be normal in children and before the age of 30. However, presence of third heart sound after 40 years of age indicates number 1, ventricular function impairment, number 2, AV valve regurgitation, and number 3, conditions causing increased ventricular filling, and number 4, it may also be heard in a patient with high output. Third heart sound is heard in heart failure. Most common cause of third heart sound is congestive cardiac failure. It is also heard in left ventricular failure in dilated cardiomyopathy. What's a pericardial knock? Pericardial knock is a high-pitched third heart sound. Originally third heart sound is a low pitch one, but this one is high pitch and it appears just after the A2 indicates constrictive pericarditis. And why does it occur? It's due to the sudden stop of diastolic filling. This is known as pericardial knock. This is here just like a third heart sound, the pericardial knock. What's the relationship of third heart sound with EKG? It occurs between the T wave and the next P wave, where right and left sided third heart sound are best heard. Left-sided third heart sound is best heard at the apex beat area with patient in left lateral position, and right-sided third heart sound is heard at the left lower sternal border or below the Ziphi sternum. Now the fourth heart sound. Fourth heart sound is also a low-pitched sound heard just before the first heart sound in the late diastole. It's also pre-systolic or late diastolic sound that is produced when there is increased resistance to ventricular filling in diastole. It's loudest at the left ventricular apex with patient in left lateral position, and it is increased by exercise. Right-sided S4 is present in right ventricular hypertrophy secondary to pulmonic stenosis or pulmonary hypertension. Why S4 is heard? When atrial pressure is high or if ventricle is stiff, example ventricular hypertrophy, in which condition a double apical impulse occur and why. In hypertrophic cardiac myopathy, a double apical impulse is felt due to palpable fourth heart sound. Causes of fourth heart sound: number 1, general condition, systemic hypertension; number 2, cardiac condition, acute myocardial infarction, ischemic heart diseases, and hypertrophic cardiomyopathy; number 3, valvular disorders, aortic stenosis, and acute mitral regurgitation. Fourth heart sound frequently accompanies delayed AV conduction in the absence of heart disease. It may also occur in sinus rhythm, and it's more in elderly. Why fourth heart sound is not heard in atrial fibrillation? It's absent in atrial fibrillation because effective atrial contraction is needed for fourth heart sound production. Fourth heart sound reflects atrial contraction in a non-compliant ventricle and or stiff ventricle.